In communities across Kentucky, from isolated mountain towns to low-income neighborhoods, access to hearing healthcare isn't just limited, it's nearly non-existent. But one statewide initiative is working to close that gap. One screening, one conversation, and one life at a time. Led by the Heuser Hearing Institute, Kentucky Hears is tackling hearing healthcare disparities head-on, bringing mobile clinics, telehealth services, and education programs directly to the communities that need them most. Joining me in studio to share more details is the Director of Operations at Heuser Hearing, Devin Woodley. So great to meet you.
Nice to meet you too.
This is a wonderful initiative that has just been spearheaded by Heuser Hearing. So tell us a little bit about how it kind of came together. You got the state involved, legislators involved. So tell us how this all kind of came about.
So during COVID, Heuser Hearing Institute continued to offer services to all of their patients, and they had this idea that we can do this statewide. There's so many disparities in hearing healthcare in the state of Kentucky that they really tackled this issue. So they had support from the Kentucky Commission on the Deaf and Hard of Hearing and the Kentucky legislature, and this program started in 2022, and we've been going ever since. So we started with 10 counties that we visited and started having these mobile clinics providing hearing health care to people in rural areas. And it has just grown over the past 3 years now. We now are in 30 counties.
Wow.
We participate in the health fairs. We go to health departments, and the biggest issue was to remove the barrier of access because so many people, one, there aren't enough audiologists throughout the state, and so we take our audiology team out to the state. The other part is just transportation. People can't get always to Louisville or Lexington or Bowling Green, so we go to them, and that has been great for the communities. We have had a lot of support and people just really want the service, but they didn't have anywhere to go. And so this has just been an opportunity for us to be there, talk about hearing health care, how important it is to take care of your hearing health care, and how it impacts your life in general, just with your ability to communicate with your friends and your family and your neighbors, how to communicate at work. A lot of people that have hearing loss are unemployed or underemployed. And then we have lots of children that have hearing issues and they're not identified early. So the other piece of that is early identification with the children in these communities. So it's really been an amazing opportunity to, one, see a beautiful state in the fall, and in the spring it's absolutely gorgeous.
Oh, yes.
We drive our mobile clinic, we drive our SUV, and we meet so many amazing people. But bringing hearing health care to the communities has been impactful for a lot of people that just didn't know and what to do, and then also they didn't have the resources. So we bridged that gap through Kentucky Hears.
And of course, it all comes with different partnerships and collaboration. So what has just been so critical in advancing Kentucky Hears mission, throughout the state and at the regional level too?
Well, first, people have to allow us to come into their communities. So we've partnered with wonderful local health departments. We've partnered with the Circuit Court Clerks of Kentucky. We've partnered with the Kentucky Retired Teachers Association. So all of these partnerships allow us into the community. They invite us in and they welcome us with warm arms, and they let people know that we're there to participate. So without those partnerships, we would not have been able to do the work that we've done in the past 3 years. We recently opened up an office in Eastern Kentucky in the Martin County in the city of Inez, and that was through the partnership with the Martin County Health Department. So they want us to come in, we want to be there, and so this joint effort is really impactful for the people in the communities. They know they have hearing loss, but they don't know what to do about it. So those partnerships have been crucial in us having access to people throughout the entire state.
Yeah, and it sounds like it's been so successful over these 3 years, but just kind of looking ahead to the next 10 years, what do you kind of see the success growing? Are you planning on opening more clinics like you just mentioned, or how are you going to get to 120 counties?
Well, that is the goal. Our CEO really wants to be in every single county, and we would love to do that. We are funded in 2-year cycles, so we really rely on our partnerships and the people that we see to really advocate to keep Kentucky Hears as part of the state legislature budget, because can only do what we can if we have the funding and the ability to do that. So part of it is making sure that we have advocates who really talk about how we have made an impact in their community. And then so for us, keeping that funding, expanding that funding is really important. As long as we keep getting funding, we will be out there. We will add more counties. We will do everything that we can. But it is going to be getting the word out. And so things like this are very important to be able to tell people we're here, we're available, and we'll work in your community as long as you'll have us.
Absolutely, and that's where you're calling on our Great Day Live viewers and really everyone in Louisville to donate. So thank you so much for stopping by our studio today, and I can't wait to see this expansion. So if you are interested in learning more, just go to thehearinginstitute.org/support to give and to learn more.